Good morning. Well, I guess it's noon now, so good midday. All right, so we're going to talk about some trends in women's health and wellness that also overlaps into aesthetics. And the two really go hand in hand. So we're going to kind of discuss what that means now in the marketplace and for your practices and just for women's health in general. So the global women's health market in 2023 was worth over $44 billion, and in 2024 is projected to reach over $48 billion. The compounded annual growth rate is projected between 2024 and 2029 to be at 10.7%, which is quite large. And I don't know about you, but in my practice, I've found, women are really asking to do as much as they can with their trusted provider in one place. So if you're doing medical, they're often asking about aesthetics and vice versa. So that's projected my practice into offering more and more over the years. Some trends that have really been emerging in the last few years especially include vaginal rejuvenation, skin tightening and rejuvenation, including down there, pigment correction, G-spot amplification, and holistic weight optimization, which we've talked about. And you can see the one slide up down there with the U.S. vaginal rejuvenation market and just that substantial growth. So I want to talk about Revive first. I don't know who's familiar with the Revive protocols, but this is energy-based labial tightening and rejuvenation. And just a heads up, there's going to be a few graphic photos coming up in this presentation. So first, there's the VST, okay? So this is going to be kind of the more gentle, warm, pulse-like RF treatment for labial tightening. I would do this for kind of more minor cases. Then we have the next level with our fractional RF, the VFR. So I've used this for cases with more substantial hypertrophy in the labial area, need for fat loss, and I'll actually present a case of mine in a little bit on that. So again, the VFR is going to be kind of the heavier hitting fractional RF, right? Dermafuse can also be used in the labial area to help with hydration and pigment correction. I don't know if you've had any patients asking you for that yet, but it's amazing when you start bringing these things up, have on your entry kind of questionnaire of things they're interested in, these sorts of treatments, and you'll find that the interest is really growing. I think we've talked quite a bit already this weekend about RF and how its mechanism works. I'm just going to go past this one. So again, with the heating, the oscillation, including in the labial area, we can help grow more fibers of collagen. We can stimulate the elastin, and the heating is very comfortable yet effective. So this next case study that we're going to do here is going to have some pictures, so buckle up. All right, so this was not one of my patients, but another wonderful physician was able to share these with us. So this was labial tightening after 6 treatments of the VST, and you can see great tightening effect there. Improvement in moisture was reported. Same thing here, 6 treatments, significant improvement. And again, when people find out that this is actually something that's available, I think you'll be shocked at how many of them are like, oh gosh, I've been feeling self-conscious about that, or it's dry, it's uncomfortable. So it's exciting to be able to offer these treatments. So now, next level, we just kind of saw a case with the VST. We're going to look at what the fractional RF, the VFR, can do for labial laxity. So I'm going to present a patient of mine, Jules. So 41-year-old female, very competitive cyclist, competing for years. So with all of the training she did, there was quite a bit of trauma, sitting on the bike, up and down, et cetera. And it had actually created really significant labial hypertrophy. So the fat pad in that area had actually grown in response to that trauma. So she was becoming very self-conscious about it. She was a very lean individual, so it really kind of stuck out. She was also experiencing discomfort down there just with day-to-day activities, and then lack of tone and stress urinary incontinence, which I'm going to get into more soon. And again, only 41 years old. She had never had children, by the way. So in her treatment plan, what I decided to do was a series of 3 VFRs, so the fractional RF, and we spaced those 1 month apart. And then we also did the VVR, which I will talk about soon, to help address the tone of the vaginal canal and her stress urinary incontinence. She was so excited as we went through this. So even after her very first treatment, there was improvement in the hypertrophy, and her stress urinary incontinence had gotten better. By the time we were completed the 3, labial hypertrophy was better by about 60%, and it was very, very significant. So she was happy with this result. Her discomfort during activity improved 90%, and her tone 80%, and the stress urinary incontinence actually resolved 100%, which is super common with this treatment, by the way. Very exciting. I wasn't able to get permission to use her pictures, but this is kind of a similar case. So again, showing a more profound treatment with the fractional RF. And this is just kind of speaking to the smart heat, very safe. It's not painful, yet very effective. And you can really kind of customize the treatments for your patients. Pigment correction. So that's another thing that people are asking for even in the vaginal labial area, is just kind of helping with lightening and brightening. So you can use Dermafuse for that, and there are covers that you can use to put over the wand so that you can treat that area. And I want to have a little more time to talk about VVR, so I'm going to kind of just go past this one here, because we talked about that yesterday. So all the wonderful serums that you can use on the face and the body with Dermafuse. Okay, so we're gonna get into VVR. I'm really passionate about this one, and it's something that, especially in the last 12 months, has really grown in my practice since we have made it a point to talk about it and ask women about these things. Have you all had exposure to the VVR this weekend? Like just seeing it? Yes, no, not seeing a whole lot. Okay. All right. So the VVR, it kind of looks like a curling iron to me. But I promise it doesn't feel anything like that. So it's a wonderful piece that can be added to any of the V platforms from the 10 up to the 30, and treats so many things. So throughout a woman's life, obviously, those of us that are women, we know it's kind of like a mad roller coaster of hormonal changes, ups and downs. And whether you have a pregnancy or not, there's also physical changes that happen throughout those years. 1 in 3 women are affected by stress urinary incontinence. I probably don't have to explain what that is to most people in the audience, but in case you're a female that haven't experienced that, it can mean, losing control of a little bit of urine when you sneeze, or you cough, or you do a jumping jack, or it can be more significant than that. 50% of postmenopausal women are affected by vaginal dryness. And having seen thousands of women in this category over the last 20 years, I would argue that it's far more than that statistic. And it can get downright painful and uncomfortable because of the dryness and the rubbing. Tissue can become sclerotic. 40% of women report that they are affected by vaginal laxity. So this is where things are getting kind of flip-floppy and sensitive, and it can affect daily activity, but also just the sensation that you have during intercourse. So the VVR has a lot of great applications, everything from helping to address vaginal laxity, improving, sexual gratification, dryness, atrophy of the canal, vaginal scars, and then that urinary incontinence. So this is kind of demonstrating when the piece goes into the canal, how it's helping to just gently heat those tissues. And the amazing thing about this versus some of the other devices out there, it's absolutely impossible to burn your patient with this. I was kind of taken back when I've had reps from other companies come into my office over the years, and being burned in that area is a risk. I'm like, no, thank you. Absolutely not. So it's very comfortable. It gives us the ability to actually look at the tissue temperature the whole time. And it's essentially improving blood flow to the area through vascularization. And it also has been shown to help with improvements in estrogen levels in that area, which of course then helps with lubrication and sensation. Patients have experienced, on average, 69% improvement in vaginal dryness 6 months post three VVR treatments. And I know as more and more patients are doing this and we're gathering data, my understanding is that this number has gone up, and I know in my practice, this percentage would definitely be higher. So the stress urinary incontinence piece is such a wonderful, life-giving thing that this device can help us with. And this picture kind of shows you a little bit of the proximity of the vaginal canal, which is where the device is going into, and the urethra. But in real life, those are actually closer together, which kind of helps to make more sense of how not only is it affecting the vaginal canal, but it's affecting the urogenital system as well. And improvements in stress urinary incontinence, over 87%. And honestly, again, in my clinical experience, it's been a 100% success rate, and we see, or rather hear, reported improvements typically after the first treatment, which is very cool. Okay, so now you're gonna get to know me better than you probably thought you were ever going to. I'm actually gonna share a personal story with you. So those are my babies. When they were itty bitty, I carried twins. They just actually turned 11 just a few days ago. And so I got really huge with that pregnancy. I stopped taking photos finally. That was not as large as I got. I know it looks like I'm carrying aliens, but I'm a pretty petite person naturally, and I carried those kids till, over 37 weeks. So here's my case. Once upon a time, I was 43, and I have a history of stage 4 endometriosis. For those of you that don't know what that is, it's likely a congenital kind of genetic defect that happens where basically you have a bunch of non-cancerous tumors growing throughout your urogenital pelvic cavity. Can go anywhere actually in your body, but usually isolated to that area. Creates a lot of hormone imbalance and pain. So I had numerous surgeries for that, burst ovarian cysts, uterine lift, C-section, twin pregnancy, abdominal hernia repair after said twin pregnancy, fallopian tube removal because of the endometriosis, and one ovary removed because of the endometriosis. So I tell you this because it created, a lot of trauma. So that was just a picture after one of the surgeries I had. And essentially, with everything that my body went through, all of those hormone fluctuations and the surgeries and trauma, it left me in a place where I was suffering from the stress urinary incontinence. Before I had any awareness that I even had to go to the bathroom, my bladder was like ready to burst. Just the sensation was kind of gone in general in that area. And, it was just, it affected my day-to-day life, my activities, how I felt about myself, relationship with my husband. And I was like, I'm still young. Like, this is not how it should be. And I look after myself. I do all the things. Anyway, so when I heard that Viora Sinclair came out with this device, which I'd kind of been waiting for, I was very excited to try it myself. So I had my female colleague physician treat me with the VVR. I also did bioidentical hormone replacement therapy. And let's see if I can get back to the one I wanted to. And after one VVR, the stress urinary incontinence that I was experiencing was 50% better. After the second one, 90% better. Sensation improved. I'm just one, I think, of many women who really had things turned around. So I've become very passionate about telling my patients and other people about it because it's such a simple treatment. It doesn't hurt. There's no downtime at all. It's affordable. And versus the alternatives out there, here's a neat one. One of the alternatives to stress urinary incontinence is being injected with silicone-based bulking agents so that it literally narrows the canal so you just can't really pee very much. How is that a solution? I mean, it's embarrassing. So I am really passionate about this, and I truly believe that the VVR technology should be a standard of care for all women, and I just really encourage you in your practices to start the conversation, have information out there, and you will be surprised at how many women are in the market and need this type of help. Okay. So just kind of some tips for helping to grow women's wellness and aesthetics in your practice. Of course, there's all the social media that the experts have been talking about. Using time during your procedures to start the conversation about women's health and wellness and the new technologies that are out there that you can offer. If you have a story, tell it, or tell mine if you want to. Share patient testimonials. Hosting an informative event is something that can work nicely for some of these less talked about yet trending treatments. And just, kind of realizing that there's a big synergy between women's wellness and health and aesthetics. They really do pair hand in hand and interrelate. So thank you for your time. And if you have any questions, let me know.